One of the largest areas of bladder cancer is in the non-muscle invasive bladder cancer space. Out of the 79,000 newly diagnosed bladder cancer patients, around 55,000 of them are non-muscle invasive. We did a trial where we took patients who essentially were BCG naive or had never received BCG for their non-muscle invasive disease. They had to be high risk. There was a smattering of patients that had intermediate risk. Most of them had never seen BCG, although there were some that had received BCG in the past, but not for at least 1 year. And we treated these patients with BCG plus a vaccine, and the vaccine is HS-410, which is a cell line that was selected because of its cross-reactivity with known bladder cancer antigens. The cell line also had a gene put into it called GP96, which serves as a chaperone for tumor antigens to dendritic cells to enhance the immune response. So we had 3 arms. We had the BCG plus placebo, we had BCG plus low-dose vaccine, and we had BCG plus high-dose vaccine. And then there was a 4th arm for patients who were intolerant to BCG, which was vaccine alone. These patients were treated with BCG and or vaccine for a total of 1 year, so they did receive maintenance therapy. And then we followed up and looked at the disease-free survival at 1 year. We reported on that at the Society of Urologic Oncology meeting, and despite the fact that we didn't see any differences in the BCG alone versus the BCG plus vaccine arm, all of those arms performed better than historical controls. So there clearly was a trial effect. But more importantly, what we're reporting on at this meeting is the immune response, and we clearly see a much enhanced T-cell priming or an immune activation with the patients that received BCG and vaccine versus the patients that received BCG alone. And so looking at a number of different methods, looking at the interferon gamma ELISpot evaluations, as well as looking at PD-1 and PD-L1 staining and so forth, we clearly have demonstrated an immune response from the combination of the BCG and the vaccine that we did not see with BCG alone. So that we're going to continue to follow these patients out for 2 years. We're hoping to see some additional separation between the treatment arms, but more importantly, we're learning a lot about the T-cell activation with vaccines, and that future studies may include patients that have not responded, maybe adding a checkpoint inhibitor such as a PD-1 or a PD-L1 inhibitor to see if we can enhance the disease-free status.